We have developed over 1,300 agents in the context of health insurance, buying and purchasing and engaging and member engagement for a given health insurance company. Over 1,300 these semi-autonomous. And the reason I say semi-autonomous, because it is important that we have the notion of human in the loop. Every step of the process, every step of that orchestration is in line with federal laws, ethical laws, members' rights, patient rights, and everything else. AI is not a tool, is not a technology. In our view, AI is a way of thinking, new way of doing things. One day, everybody realizes, just like AI for many, many years, if you call yourself an AI data scientist in 2015, 2016, you will not get any response from anybody else. But today, all of a sudden, since ChatGPT, now AI product managers making hundreds of thousands of dollars. Netflix is paying them fortunes, and Metas and everything else. Persistence, passion, hard work, solve a problem from 5 or 10 years from now. Don't solve today's problem.
Hello, and welcome back to the Healthcare AI podcast, where we explore applications of AI transforming healthcare. I am Oksana Meyer, Product Marketing Manager at Jon Snow Labs, and we have an extraordinary conversation lined up for you today. So my guest is Eugene Sayan, founder and CEO of Softheon. If you're enrolled in health coverage through healthcare.gov or state ACA exchange, you've probably used Softheon's technology. And I'm very happy to welcome Eugene. Welcome to the show. It's a pleasure to have you.
Thank you, Oksana. It's wonderful to be with you. I am excited about what's about to come.
Right, so I would love to kick us off with a little time journey. Would you take me back to 1998? So you've been at IBM working with Fortune 1000 companies, and you filed this patent describing intelligent software agents. What were you seeing in those enterprise workflows that made you think we need systems actually that can learn and optimize themselves?
Sure, happy to. I would like to take you a few more years back to that journey, if you will. So when I first came to United States from Turkey to pursue my education, having received my electrical engineering, I was always fascinated with the computers. So I found myself basically working for a company along the way, worked for a company funded by IBM. This was one of the early startups backed by IBM, and IBM was one of our biggest customers. But like everything else, the day of a startup's a kind of a very short span, if you will. Then I found myself leaving IBM, but to be exact, my program was canceled at IBM. But then I'm always, was so much into the innovation that we learned at IBM. So I kind of took the baton, if you will, took the flag, and I proceeded with filing for that patents in around 1998. It took me about 2 years to get everything documented. Receiving a patent is a complex process, as you can imagine. So the idea really was something that we start working back in the days with my colleagues at IBM about automated agents to manage different aspects of computers, applications, and networks. So these semi-autonomous, in some cases, autonomous agents is the foundation of the patent that we have filed. And then based on that patent, I am proud to say that we in fact, implemented many critical parts of the patent as the foundation of Softheon's technology. So fast forward 25 years later, we're still leveraging those concepts and ideas. And of course, it morphed over time, those concepts. and brings us today to talk about what is AI, maybe, and how we use AI in the world of healthcare, in particular, as you mentioned, healthcare.gov or other forms of what we are tokening the phrase is a consumer-directed healthcare in the United States. So kind of we have reached that inflection point where the healthcare, health insurance experience is now something that individuals or consumers are empowered to make and be responsible of their health and well-being using these technologies, many of them now powered by AI.
Right. It's really fascinating what journey you've gone through in this over 20 years. Were you always building toward agentic AI?
I will say probably, AI wasn't a buzzword back in 20 years ago. In fact, wasn't a big buzzword until the advent of ChatGPT. All of a sudden, AI became a real. Up until then, it was more of a science fiction concept altogether too. But Softheon has always been an agentic company. And again, in the industry we have chosen, the problems that we have decided to solve, healthcare is a very conservative industry in the United States or across the globe. Our application has to be, 100% accurate, even a 99% accuracy for a doctor's diagnosis is not acceptable, 1% error rates. And in fact, we talk about here that how healthcare kind of resembles the airline or air traffic industries. In the United States, in a given day, there are 70,000 planes. They take off and land. And imagine if there was a 1% error rate. Okay, we're talking about then 700 plane crashes a day for a 99% accuracy, which we know that will not be acceptable. So our thinking is very much in the same line of thought. So we have been an agentic company since our inception. And what we have done is taken a very complex process, a very complex experience. For instance, purchasing the right health insurance that fits your needs, your specific personal needs, based on where you live, based on your age, based on your medical condition. These are complex decisions and complex processing that needs to take place to manage the risk, to calculate your premiums. So we have taken a complex process, a problem like that, and we have broken down to what we now call as a LangChain workflows, or in general, MCP workflows, MCP power workflows with multiple agentic services performing one small part of that end user experience. Of course, all that work, it happens kind of what we call below the waterline. And tip of the iceberg, what consumers experienced in the past was initially websites, then later on mobile. Now we know that the interface of the future is going to be a chat or voice-based interfaces. So our technology kind of evolved over time now that our clients are not as intimidated with the concept of AI, and they no longer view AI as a sci-fi. They are ready to bring these conversations with their members, and we are now able to explain all the capabilities now available within the Softheon platform. So in short, we have been always an agentic company. Only recently, we are appending the word agentic AI company, and that's what patent back in '98 was talked about.
Yeah, it's really interesting how your idea back then just helped to materialize in the recent years with, first of all, LLMs, generative AI, and that enables actually AI agents. And now I see you orchestrated beyond even. I know that you have developed this framework speaking about autonomy, alignment, and accountability. So, because these are the essential, I think, elements for healthcare companies deploying any AI solutions. Could you explain what do you mean by those components of the framework?
Absolutely. Now, as you can imagine, in the world of healthcare, um, everything has to be recorded for the purpose of traceability and auditability, because we're not talking about some random data. We're not talking about shopping experience or even anything else related to this thing. When we talk about healthcare, every bit of information is important. As you know, in the world of providing care and services, there are over 70,000 codes associated with every little service a patient or member receives in the context of a care from a doctor, from a hospital, from a clinic, whatever that might be. So all these decisions has to be validated before it can be even aggregated in some kind of a diagnosis. And let it be, something more severe like a heart attack or cancers and everything else.
Yeah.
That is the care aspect of it. But we also have the similar responsibility on the what we call it an administration part of the business. We need to make sure that when someone purchases health insurance, they need to make their payments. If they don't make their payments, their insurance will lapse or maybe put into an on hold. We call it a grace period. And if they don't make their payment 3 months in a row, the insurance companies have a right to terminate those policies. Of course, this all has to be done with data. So in essence, that our system follows those exact three paradigms you mentioned. We talk about alignment, which is the orchestration aspect of these various components. Again, today we have developed over 1,300 agents in the context of health insurance, buying and purchasing and engaging and member engagement for a given health insurance company. Over 1,300 these semi-autonomous. And the reason I say semi-autonomous, because it is important that we have the notion of human in the loop, meaning that when agents make a decision, we need to make sure that that decision does not contradict, the topic of hallucination. I will call it probably over time it will get better. Just as a 3-year-old child have a big imagination, now AI these days have a big imagination and often becomes a hallucination with a very significant adverse effects. So semi-autonomous human-in-the-loop interface provides us the opportunity to make sure that every step of the process, every step of that orchestration is in line with federal laws, ethical laws, members' rights, patient rights, and everything else. Like, as I said, we have to be secure like airline security systems so that there is no bad actors, bad processes are allowed to get into the system. So finally, the last part is obviously the accountability. And that's the part that if we make a decision, and again, like any other business, health insurance companies are in the business for being somewhat profitable, if not sustainable, even if they are not for-profit organization. In many of them in the U.S. and as well as where you are in Europe, healthcare is for the reason run by the governments. But that accountability is in the U.S. is delegated to the privately held entities, but we are ultimately responsible of the outcomes. So we want to make sure that we are not terminating wrong peoples. We use the term do no harm. Our AI framework operates on the principle of do no harm, meaning that we cannot make wrong decision and cause a harm one out of nearly 10 million people using our platform behind the scene. So every decision we have to make the right decision. Now, there are always going to be some exceptions to the process, and we have ways to recover, remediate, and resubmit those transactions for their completions. But ultimately, we have to be right at a minimum. I will say 100% is a little idealistic, but our systems are designed to be 99.9999999% right. And that's what we are aiming for.
It's actually only sounds easy, but in reality, to build a system that reliable and also empowers like accountability, it's super difficult. I would like to switch gears a little bit and talk maybe shortly about US regulations. It's quite a complex patchwork from the states. There is so much fear actually about AI in healthcare, about the privacy concerns, about replacing doctors even. You talk about AI empowering patients. Could you paint maybe a picture? What does that actually look like in practice for people?
Sure, absolutely. Now, again, our interactions are very limited with the patients. It's more about membership. Like any other industry, healthcare has the same exact problem, which is 80% of our members are healthy. They don't have a chronic diseases, but the remaining that 20% actually almost is responsible of all the 80% healthcare spending in US. So our goal is to really focusing on that 80% healthy population and keeping them healthy. But the privacy concerns is the same exact thing, whether it be a patient or a member, make no difference. So those data related to the we are going to call the member's journey from the day they were born, they're being cared for it, and through their entire lifespan, and they go through the journey altogether too. So every aspect of that journey has to be safeguarded and protected. So in fact, one of the things that we have, I'm proud to say, Softheon has achieved over the years, we look at AI in 3 different layers. Layer 1 is the actual hardware and servers and data centers. I am proud to say that we have built 2 data centers of Softheon. All our applications reside on Softheon owned hardware because of the same concern that you just mentioned about sending this data to some third-party entity. We don't know what happens with that data. It sounds great. It sounds very easy to do. But like the old saying, if the product is free, you are the product. So what we have decided, we have diverted significant investments and we built our data centers and our hardware. So we own and operate the AI layer. And then we have taken the platform level. So we call it our AI platform, like many other products out on the market, just like Johnson Labs, and we leverage a lot of the public LLMs. And what we do is take those LLMs through optimization. We go through the fine-tuning experience, distillation experience, and then finally, very optimized RAGs, right? Retrieval augmented generations. And through the years, especially the last 2+3 years, since the foundation model became available, we have adapted those models strategically as a translation layer in our agentic, which we can talk about, Softheon's implementation of MCP protocols, something very similar to it. We have proprietary, of course, unlike what is Anthropic has released. So our agents speak with one another through our model context protocols as well. So that's what our platform level provides. And thirdly, these applications, ready to deploy, ready to use, SaaS applications developed with AI data centers, with AI platforms, and with the ability to provide instant low code, no code application suite that we can customize to the needs. You mentioned about the rules of in the United States. There are federal rules to begin with. And then in the United States, being such a big country, to every state plus the district of the Washington, D.C., they have specific rules that sit on top of the federal rules. So as we have clients in every state in the United States, we have a different configuration, different model context associated with a given state. So through these 3 layers of breaking up the problem and implementing the right way, let it be storage and security and reliability and disaster recovery, business continuity. Remember, our system has to be up 24/7 times 365. Every day we have to be available to our systems. Otherwise, we will cause harm to those members, as we just said it. So our platform gives us that extra layer of AI knowledge, especially around interpreting the inquiries coming in requests to our structured data format and taking the output in structured data format and converting into a text, a consumer-friendly language through our natural language translators. And that's being provided to our clients for 10 plus million people, like as I said. And every month we have basically 10 million plus monthly active users are using this platform at a minimum to pay their invoices and use the system to, if they have a change of address or they get married, they have children, they get divorced, they get retired, all that information is available through these 3-layer approach to AI as we describe here.
It's really complex, but holistic approach, I would say. And funny enough, we were doing the MCP podcast this year when Entrepreneurship had this release, and we were looking for some implementation already in production. I should have contacted you then. But
I am
really
happy to be back whenever you ask me to join you. So I will be delighted to maybe join another podcast when the time is right.
Absolutely, that's really fascinating, and also with like starting from scratch, building the data centers and operating it. It's really a difficult work to do, not mentioning the software operating application for 10 million users daily. What do you think is the most challenging problem today?
There are quite a few, but I'll break it down to maybe 3 parts altogether too. One on I'll call the people challenge. AI is not a tool, is not a technology. In our view, AI is a way of thinking, new way of doing things. Being able to connect to an advisor, being able to connect to an agent that you can delegate these little tasks, right? So you have to, as an individual, you need to adapt AI as a way of doing things, not just to summarize my emails or write me a new text and so on and so forth. And I think that it is becoming almost evident that almost every industry, every profession will be impacted by AI. And obviously, the impact in healthcare is a welcome interruption if you think about it. I don't know the situation in Europe, but here in the US, we have a big shortage of doctors and nurses.
Yeah.
Now with AI, we are able to make those doctors. Wouldn't that be amazing if you can make every doctor 2, 3, 4 times more productive by taking the small, troubling, routine, mundane tasks. Let it be, again, one of the big use of AI, which is not our domain, but I do speak to quite a few CEOs. In fact, I just came back from a major event and spoken to about literally 2 dozens of CEOs that there's the ambient listening aspect to it, right? You don't need to type into these now things. Let it be part of a customer service, interface in the world of CRM, or it could be in a settings of care delivery. So that's one area that we see a lot of the people are being using these things. Another one is prior authorizations, right? Being able to make sound decisions. What really AI has done is, at least even in here at Softheon, I can tell you that we've taken our best financial analyst. Well, we made that knowledge available to every financial analyst. Even a person starts within a days, he or she able to operate with that domain knowledge if they are using our homegrown AI agents, right? So people aspect is really important. Second part, obviously, the processes. As I mentioned, AI is a way of living. In essence, AI is a process optimization. Now, every one of our processes can be optimized in a way. Let it be from anomaly detections. Again, we just talk about how important the security and the safeguard of data. Well, how do we make sure that there are no bad actors are trying to break in? And I can tell you, as we are speaking, we have teams of people that are basically fending our systems. Remember, we have 10 million people. They need access to our system 24/7 from anywhere. Well, it's the same access could be exploited by nefarious actors. So we really have to let the good people come in and bad people turn down. So these kind of anomaly detection, threat detections, and as well as other aspects of our standard operating procedures has to be and has been optimized with AI. And then the thirdly, the technology. Everything is now faster and cheaper and better to a certain extent with AI, because we are now increasing our engineering velocity. We are writing code that writes code, right? We are seeing those things. We see all the vibe coding. I think vibe coding right now is a kind of an entry level, but make no mistake, as I give you this concept of 3-year-old kid with imagination, once that kid AI grows to be 6, 7, 10, 15 years old, can you imagine what ChatGPT version 9 or 10 will do? And at some point in time, we're going to reach a point of diminishing return. And I'm sure that there's going to be a new technology evolving by then as well. So the technology is something that is accelerating, as evident from the adoption rate, how fast these AI companies are growing, from OpenAI to Cursor to Anthropic. And we think there are going to be a few more of these companies that are going to be a new way of doing business. Technology, processes, and people, down to people talking about billion-dollar solopreneurs. So I know there's so many buzzwords being thrown out these days, but those challenges, we view them as an opportunity. Frankness, I wanted to kind of group them up there. We have always been very much in tune with the innovations, because one of the problems, especially in the US healthcare system is designed by literally 30, 40 years ago. And being such a conservative system, the rate of innovation in the US healthcare system is really doesn't have a good track record. So hopefully AI will change that thinking, because we call AI as a way that make healthcare a commodity. What I call it a commodity. What is a commodity? I will say, in fact, a precious commodity, such as clean air, clean water. I've been to Switzerland many times. I'm so impressed by how clean the air there, how clean the water is. Unfortunately, there are parts of the world, they don't have that, the precious commodity. So we think healthcare is another precious commodity that everybody deserves, everybody should get it, but also they need to learn not to pollute the air, not to pollute the water. So there is the element of responsibility associated with that right. There is a privilege that needs to be safeguarded. we think AI is going to be a big thing in the U.S. healthcare system and across the globe, because the issues with diabetic people in the U.S. or obesity is the same issues in India and China and every other part of the world. So this represents a unique opportunity for U.S. healthcare companies to, in fact, expand beyond the national boundaries. And I can see similar engagement opportunities, being that, John Snow Labs based in Europe, but I know you have employees all over the world that you work with them together. So healthcare is almost becoming another form of universal product, universal solution. So we'll talk more about that too, as I see healthcare as a form of universal income, universal basic income, ultimately.
That's a fantastic vision, and I cannot agree more that everyone should have that universal accessibility to the healthcare. What do you think must happen in order to let the innovation drive the healthcare industry, or at least unleash those new opportunities that is very challenging considering the regulatory framework and governance? Maybe you can elaborate a little bit more what should happen to get to that vision.
Sure. As I mentioned, the challenges in healthcare or AI in general, I mentioned about the technology and system that is being operating in here now 30, 40. This dates back to, I believe, 1960s, when the first socialized medicine was passed in the United States, which was Medicare and Medicaid, right? And really hasn't changed as much since then. What has changed, with respect to my friends from, at McKinsey or Deloitte or Boston Consulting, they're brilliant people. They found a way to create these organizations. So the first resistance is from the incumbents. I don't want to give their names, but you can quickly pick up who those consultants work for. They have created these systems and organizations and big moths. It's very difficult to penetrate into these organizations. And so being that incumbent, being that this is the way they have done business, there is a natural tendency to, they don't want to, quote unquote, cannibalize their own businesses.
Absolutely.
And the rules and regulations became so complex. Softheon goes through 7 or 8 different audits in every given year. Every decision we make, it gets scrutinized. Now, every audit is a major expense. Every audit is a major disruption to our work, because we have to stop whatever we are doing. We have to answer the auditors. We have to generate these hundreds of thousands of pages of documents that proves that we are acting with ethical responsibility, accountability, and so on and so forth. So I think the first and foremost that we believe we need to transition. I'll go back into the technical mechanics. The systems that are being performed or built, it's really what we call it a fee for services. It is almost going to a doctor or going to a restaurant, and you basically order your food, and at the end you pay the bills and whatever that needs to be done. Now, that is fine. There's a good reason why there is a price next to each thing on the menu. The problem here in the US in particular, the consumers were never informed, were never encouraged to understand what that menu is actually cost them. Because in a way, the payment aspect of healthcare is being separated from the consumer. So in essence, consumer really doesn't have a clear understanding. It is almost going, in the US, we have this thing called all-you-can-eat buffets, right? Can you imagine all-you-can-eat buffets? You go up there and you walk away without asking, really, what is this costing us? And the smart people on these smart organization, they created a system, what we call it a fee for schedule. So it's kind of a little thing between the doctors and the insurance companies, but the actual patients and members don't really have understanding exactly what it is. So one thing about the Trump administration is doing right now is enforcing transparency rules. So imagine a day when you go to a doctor or a hospital to say, I see that you wanted to prescribe these things. How much is going to cost me? And that question itself is going to create a lot of next steps in the conversation, which is this vague term in the US called value-based care. What that really means is, let's not worry about counting the menus and what's up there. Let's talk about how nutritious that meal is, right? Rather than pricing the salad and the soup and all together. Wouldn't that be amazing that every restaurant is a dietitian and knows what you should be eating, Oksana? In fact, on occasion, you may cheat a little bit of sweet and here and there. But for me, during the pandemic, I became diabetic because my lifestyle changed. I was working from home. I gained weight and I refused to be on insulin. I said, I'm going to change everything else. So now I lost 30, 40 pounds. I am no longer
Wow.
diabetic. I'm eating healthy. I'm in this thing called keto diet. Pretty much, I love bread. I have to give up bread. And I know how much Europeans love bread. Without that, there's no life. But unfortunately, those are the things really didn't help me as an individual. So I have to give up those things. So in essence, these questions make me think about my own health. Back to the precious commodity, right? Healthcare should not be free to everybody else. I think should be available, but you need to have the accountability. Ultimately, we don't want our government to tell us what we should be eating or how we should be living our lives. So smart, empowered individual, and I think this is why AI is going to be so important, that help me make the right decision.
I'm really impressed, first of all, by your achievements personally, because my mom is actually diabetes, had type 2, and I was vibe coding an app for her just so she can, based on her location, she can easily find some recipes from things in her fridge and get more healthy diet at the end of the day. I'm really impressed with your results.
It's possible, honestly. It, Medication is not the only answer, and that's really the
Yeah.
key point. Small lifestyle changes can prevent years of, as you know, the diabetes is now connected to everything from heart diseases to Alzheimer. In fact, Alzheimer is now being relabeled as a type 3 diabetes. So
Right.
just small lifestyle changes makes a big, big difference. So I wish you and your mom all the best. And yes, she can do it. I am confident that she can turn it around and enjoy being with you for many years to come.
Fingers crossed on that. And I really hope that transparency would help to align the incentives between different stakeholders, because it's one of the fundamentals, I think, as well. You've made this fascinating, actually, comparison that, like, I was in the preparation to this conversation, I thought that healthcare is going through the transition, meaning shifting from pensions as it was before to 401ks. In other words, from institutional control to individual responsibility. This is one part of it. Is that shift good, you think?
You asked the question, what can be done to really bend the cost curve of healthcare, make people more informed about their decision about health and wellness decision. As you know, ACA, Affordable Care Act, it really brought health insurance for the first time to tens of millions of people. Last year, nearly over 24 million Americans received their health care through government subsidized insurance. And to the point, in fact, those individuals are more engaged perhaps about their health care, which we call it individual coverage. They are looking for a better healthcare solution, cheaper premiums. So they are comparing health insurance products, much like comparing a flight on, Trivago or Kayak. So you can find the best, plan that fits your budget. Under the Trump administration, that took to the next level, which is with the introduction of individual coverage health reimbursement account. Individual coverage carry on from the ACA to the health reimbursement arrangements, I should say. And what really is, Oksana, is in the US, as you know, many companies are no longer offering pensions, and our government offers very limited Social Security. You can barely, pay or maybe rent with that money. So individuals are left to save for their own retirements. And we have this thing called 401ks that's being created, or IRA accounts that you can actually save while you're healthy, while you're young, like yourself. And you can, every month, you can put aside maybe a couple of €100 and everything that, by the time you retirement age, you have a safety net for yourself that you created. So what is really happening with the introduction of ICHRA, or we call ICHRA for short, is the employers have traditionally decided which insurance company the employees should buy from. So it was the HR department's responsibility to pick the right insurance plan for their employees. Well, guess what happened? Since the pandemic, any organization, most of the organization basically became a remote organization. Now everybody is working from home. Well, that gave the employees the option to relocate. So even for Softheon, we now have employees in, I don't know, like 30, 40 different states. Just like Johnson Labs, you have employees and colleagues in different countries. Now think of it.
States. Yeah.
Exactly. And think of it now, you as the employer, we want to offer the best benefits because we want to attract the best talent. And one of those benefits is health insurance. But it is our HR department decides what's good for you, what's not good for you. ICHRA eliminates that problem. Instead of we decide what is good for you, we will say, okay, Oksana, I'm going to give you a rough number in the United States. Here's a $500 for you a month, Oksana. You go buy the health insurance that you want. Now you can pick a health insurance company in your neighborhood with a doctor's affiliated with the health plan who knows you quite well. So healthcare is very, very local. We hear this in the US all the time. I'm sure it's the same thing even in Europe, any part of the world. Healthcare system in Switzerland is very different than in Germany or France or Spain because of a culture, eating, dietings, and all those things all together too. So ICHRA is a way for employers to empower their employees by providing them a contribution. We call it a defined contribution every month. And then employees now has the empowerment to decide which health plan they want to choose that fits their needs. And there are so many different elements of that of that new law. So unfortunately, it's not fully implemented. It is an executive order, and but it is pretty much a bipartisan. We are hoping once our government opens up in here, we know that we have a very different political system in here. But we believe and we hope that both Republicans and the Democrats will come together and they'll pass this law, which then empowers every employee to go out and buy the health insurance that fits their needs the best way. And again, as you can imagine, we're talking about plan selection, which is a very complex experience. And this is where we believe AI is going to be a very, very valuable, because your AI agent, almost like what travel agencies used to do it, now imagine electronic AI agent can help you pick the right plan with a series of Q&A questions based on, once it knows who you are, your family compositions, your habits, your prior conditions, it can recommend the best health insurance for you. So we are taking the basically magic or myth out of the science. So we're making healthcare simple and easy and understandable by every individuals versus an HR manager decides what you should have as your insurance package.
Actually, it's pretty interesting because right now the government shutdown, which we all hear from the news, and the enrollment for those healthcare plans are open. Actually, I think millions of Americans are trying to get health coverage. So, and the cost is important, the accessibility is important. The communication, how does it happen? Could you describe me how this process looks like from your perspective? Softheon is sitting at the center of the infrastructure for this.
Right. So in fact, I'm gonna give you a slightly maybe a different perspective. Is that we view our engagement with consumers on three fronts. One is consumer engagement, right? Helping them out, picking the right health insurance, educating the consumer in the process. So that's one aspect of it. But just like everything else, right? I'm sure that you've been to a restaurant after seeing all the reviews and menus, but you experience differently when you get there. So there's always going to be some aspect of analytics. So second part of our technology, from a value statement, we call this consumer analytics. So obviously, this goes into the kind of an ML ops model, right? You take all the data, run through this thing, you make sure that the people are utilizing the system. We want the right engagement. We don't want people to buy insurance but never see a doctor, because that's not a good exercise. And there are people, unfortunately, goes through that, right? Or there are people overtaxing, overusing the system. It's causing a lot of issues. I mean, we have big problem, and I suspect this is going to be a global problem. Like as I said, all the way from lifestyles, social isolation is a big problem. Basically, people are going to emergency room to socialize with other people because they are basically loneliness, and is becoming a big problem, especially among the elder population. They are alone by themselves. Um, and substance abuse, mental health, these are big problems. So we want to make sure that we are analyzing that data. And then the third part, we call this consumer education or persuasion, to a certain extent, right? Giving your mom's example, imagine when she receives her health insurance bill or something along the line, every month you say, you got to pay us this much money. And she can say, did you get your diabetes? Did you get your retinal check? Did you get your food exams? Did you get your vaccinations? So these little nudges, we call them up there, right? We want to help the people, nudge them in the right way, because healthcare, especially when you're healthy or you think you're healthy, you don't really do anything about it. So instead of calling the system really the sick care system, we want to make it a wellness and healthcare system. So communication is really important. And this is why, again, AI becomes really, really important. And when you log on to a portal, or when you log on to a system, or you talk to some point in time, very soon, chatbots, the systems are smart enough to know who you are and give you the information in a way that is highly personalized for you and for your needs. So obviously, I don't want to go into the deep topics that I know Vaisal and I spoke about this. We talk about the time series, the Markov chains, the Monte Carlo simulations. There are a lot of underlying technology that we use to be able to create that level of authentic and specific prescriptive information using data, using AI, using ML ops.
Right. Actually, it enables even more granular approach to patient's journey. I think you've been also mentioning them before, collecting all these touch points. That's really something we are trying to build right now as well.
Like as I said, we are here. We are again. Your organization is amazing. I know Johnson Labs, and we have listened to many podcasts all together too. And we have opportunities to work together. I'm sure that will be one of these days. So yeah, I'm happy to answer any question you have. I mean, I am a workaholic. I'll tell you that much. If you ask me about my hobbies, that's going to be a very boring topic to discuss because my work is my life. My work is my hobby. So I enjoy what I am doing in here, and I've always been very curious about learning new things, and the last several years I've been indulged into the LLMs and transformers and other things. Happy to answer any question you may have.
I am pretty interested in the entrepreneurship topic, which is full of difficult moments. Or maybe you can tell me how do you define success?
I think really is that kind of I don't define them as a success because it makes it look like as if it was a trophy, right? You have to win this thing, and that's just when you're successful. It's just like I as a person, individual, again back to my roots, my dates, and my country where we grew up all together. So it's a lifestyle, in my view, and the make no mistake, I have plenty of mistakes like any entrepreneur does it all together too. So the most important thing for anyone, let alone an entrepreneur, or you might be working for an organization as an employee, doesn't really matter, is you have to find joy in what you do. In other words, you have to really learn to love what you are doing. And the best way to do that is it's one thing that we use here at Softheon. We start every meeting, every conversation with an accomplishment. What did you accomplish yesterday or today? Or if there's nothing, then you can say, what about the week? What did you accomplish the week? And sometimes you go back into months because there are some big, long projects. It takes longer than a day or a week. So finding that optimism, accomplishment, it kind of helps you ground it. It's a kind of expressing your gratitude. All right, because this is a very difficult work. You know that, and this is not the work we do. I just threw phrases like "do no harm." People join us, and the first thing they hear from us, "do no harm." That is a heavy load on someone's shoulder who just graduated from college and 20 something years old, 23, 24 years old. And we're telling them to say that be careful, don't make mistakes. If you do, people do get hurt, people harmed. So it's a really difficult. So the optimism really good, but then you really don't want it to be too much optimistic. You have to be realistic. So then we pivot into the issues, like what are the things that are preventing us from completing more accomplishments? And then the third part is the next steps. I call it, okay, you got that 5, 10, 20 issues. What is the top 2 issues you're going to solve today? And ignore the rest of it. And when I say solve it, we look for who you're going to help. Who's going to help you solve that problem? We call this clear next steps with dates. We call it SMART goals: specific, measurable, attainable, realistic, and time box. So your next steps every day, we encourage everybody at Softheon, every engineer, every product manager, every client analyst, executives, they have a 3 to 4 next steps. They are laser sharp focus to complete. So next time we meet, we will love to celebrate them as an accomplishment. And that's the cycle goes through here every day.
Absolutely. There is a loop, I think, as well. Also, given your incredible experience building company ground up, and you have built the AI technology as well in your tech stack, what would be your advice to healthcare executives who is considering or trying to figure out their AI strategy?
As an entrepreneur, this also goes back to me. I mean, we started this conversation with a patent that I have filed in 1998, right? And this is perhaps one of the best advice that I got from an early mentor of mine. And he said, Eugene said, solve the problem 10 years from now or 5 years from now. Don't try to solve today's problem. Don't try to chase these quick wins, quick successes altogether too. Because those are, some may be a good problem. That's a lot of, I don't want to generalize it again. There are always an exceptions. But if you can visualize and if you can think about a problem 5 or 10 years from now, and you start working on solving the problem today, because it's going to take you 5 years to build the solution, I can assure you, right? There's a very famous hockey player in the U.S. His name is Wayne Gretzky. And his famous word says, I don't chase the puck. I skate where the puck is going to be. So as an entrepreneur, you have to learn to skate to somewhere that there's nobody around you. And this is where the danger comes, right? If you don't enjoy what you are doing as an early entrepreneur, you will be called upon. You're the crazy guy. What are you working on? There's no problems. What are you trying to solve? Go get a real job. And frankly speaking, these harsh critics, most of them are your friends and family, because they see you and they think that you lost your mind. You're like, what are you doing solving a problem from 10 years from now? Right? Why don't you go get a real job and make money and this and that all together? Because, people not going to pay you once you have. But one day, everybody realizes, just like AI for many, many years, if you call yourself an AI data scientist in 2015, 2016, you will not get any response from anybody else. But today, all of a sudden, since ChatGPT, now AI product managers making hundreds of thousands of dollars. Netflix is paying them fortunes, and Metas and everything else. So persistence, passion, hard work, solve a problem from 5 or 10 years from now. Don't solve today's problem.
It's a great advice, actually. Looking 10 years from now and trying to figure it out, what the world would look like and what kind of problems we need to solve today to get there. I think you're well away on the journey. So Eugene, this has been incredible. Thank you so much for taking us through your journey, through your experience and vision. For everyone listening, we would love to know what resonated with you, what questions would you have asked Eugene, and drop us a note on YouTube, Spotify, Apple Podcast, or LinkedIn, wherever you are listening to this. And if you found this valuable, please share this conversation with someone who is also in healthcare and AI. This actually matters. So you can find Eugene's on LinkedIn and learn more about Softheon's health plan solutions at softheons.com. All the links will be also added in the show notes. I truly appreciate this conversation, and thank you so much again.
My pleasure. Thanks so much.